I'm Harmon from Make It Fair. Last week, we filmed a segment regarding the challenges of repealing the Affordable Care Act. And in the time between recording and now, much more has occurred. While these new developments don't change the overall content of our original piece, it's important to add the context of where we are presently. On Tuesday, July 25th, 2017, the Senate took a vote on a motion to proceed. It came down to a 50-50 split, with Vice President Mike Pence offering a yes vote to break the tie, thus passing the motion. While this appeared to be a victory for Senate Majority Leader Mitch McConnell, it is merely procedural in nature. The motion to proceed only now brings a debate to the Senate floor for a bill that is not yet written and has no definitive measures. However, as a bill develops through this Obamacare repeal process, gone is the need for a 50-vote threshold. Now, a supermajority of 60% of the Senate will have to be in place for this new piece of legislation to be passed on to the House. And after already losing 9 GOP senators who voted no to the first series of proposed amendments last night, it appears the battle for an Obamacare repeal is still very much an uphill battle. Stay tuned, because with so much changing so fast, we'll likely have to come back to further update you. But for now, we'll segue to our segment recorded last week. But joining me now is our executive producer, Stuart Phillips. He is a retired orthopedic surgeon. He's been greatly active in corporate medicine. He's ran one of the largest orthopedic practices here in Louisiana, and he's also been a clinical professor of orthopedic surgery at LSU. So to say that you've got some expertise on this issue from every angle is more than a fair statement, wouldn't you say?
I think.
You think?
Yeah. I've been studying medicine since 1959. And I've run medical practices. I have developed medical devices, and I have been involved both as a physician and as a member of a corporate environment, building hospitals and making the ability to develop medical care more than theoretical and practical. And what we really think of is that when you read about what's going on with healthcare, it's confusing. Everybody has a different opinion, and nobody really understands why this bill failed. And we want to explain it to you. And we think we can explain it to you on the basis of our organization, Make It Fair. We think that the reason it failed is a failure of governance in the United States and not a failure of healthcare. And we're going to try and do this by showing you what's really going on in medicine, and that's what's really going on in the decision-making process.
Well, so about 12% of the public seem to have been in favor of some of these repeal and replace efforts. Why were they moving forward if the actual people of the United States don't find it favorable to such a great degree?
That is the crux of the problem. Behind me on the wall, you'll see a picture of the decision makers about health care. If you note, they're all elderly white males, there are no females, and there are no doctors. Amazingly enough, there are half a dozen physicians in the Senate, but none of them were let on that committee. So it would tend to suggest to a thinking person that probably the decision was not medical.
Mm-hmm.
So what was the decision? And let's see if we can figure it out. 12% of the people support the bill. Who does support it is the Senate Republicans, Trump, and the super rich. And the reason there's the super rich support it is that this was the first bill that actually taxed the super rich. Now, most of the people who listen to this don't make over $250,000 a year
Right.
and don't have a lot of capital gains. But luckily I do. So I really do understand that this bill has a 3.5% surtax on my profits of capital gains.
And by this bill, you mean the one that they're trying to pass?
No, the one that they're trying
To repeal.
to repeal.
Okay, I want to make sure we're on the same page.
Good point. Now, all of this is to get rid of Obamacare, because Obamacare was able to tax the rich people, and they are upset.
I've heard some attempts to describe the Affordable Care Act as a bit of wealth redistribution by allowing some people to have access to care while taxing the people that could afford to pay back into a system, invest back into the country that made them.
That's one way of putting it. The other way is it's a way to make it fair. If a working man makes $100,000, he pays 35% of the top part of that to the federal government as income tax. But if you can afford to bribe your congressman and you have capital gains, you only pay 10%.
I see.
Now, with this bill, you pay 13%. Now, if your twisted way of looking at the world, if rich people paying 13% is unfair, but moderate people paying 35% is fair, then you belong in the 12%.
Okay.
But who isn't in favor of this bill? First off, I'm not, this is an opinion, this is what they said, the American Medical Association, the American Hospital Association, the AARP are all against the bill. All against doing away with Obamacare. So you have a group of people who are trying to put in place a bill which all of the healthcare people want. And there has to be a reason.
Well, so the people aren't in favor of these replacement opportunities. The medical community, all these other agencies say this is a bad plan for America. How does that translate to a political victory if they had been successful?
Well, the way people win in our political system is that the people that are able to get the most campaign contributions are the people that are most successful. Now, everywhere else in the world, if you were to give money to a politician to have him pass a bill that made you save money, that would be called bribery. But in the United States, we call it campaign contributions.
And that was supported through the Supreme Court's upholding Citizens United. It said money is free speech. Is that?
It said money is free speech. And it should be noted that the people that say that are almost always the people with money and almost never the people without it.
So, I mean, free speech is not a level playing field under these circumstances.
Free speech would be a very level playing field, paying the politicians a lot of money to say that money is speech does not make
it fair.
It does not make it fair. So, then the question is, why is that so? And it's so because this bill was a bill that was a political rescue bill. The Republicans for the last 7 years have been saying that they will repeal Obamacare. They have been saying it to their constituents who, for all sorts of reasons, really don't like the bill. Now, no one would suggest that any one piece of legislation is perfect.
No.
And everyone would suggest that there could be ways to improve it, but that's not what this was supposed to do. So what was this new bill supposed to do? It was supposed to decrease the tax base on the rich people and increase the suffering and disease load on the poor people. And how could that be in a democracy?
Is the idea that if people possibly don't have access to the health care they need, die off, then there's less of a population to care for?
Who knows?
What's the calculus on this?
You could ask them that. My feeling more likely is that a certain percent of the population just don't want to pay taxes, really don't think that human beings have to be compassionate or care about their neighbors, that it's every person for himself, and that they are going to do whatever they can to make as much money for themselves, and they don't care about anybody else. And as we noted, that seems to be about 12% of the population. So
right.
There's 78% of the population that don't feel that way.
88%.
I'm sure. 88%, right. My math isn't very good. My emotions might be. So, what can, why did it happen and what can we do about it? It happened because over the last 60 years, we have had a concentration of wealth. The rich people have been able to influence the elected officials. So let's do a thought experiment. A thought experiment. If politicians don't get campaign contributions from special interests, they would probably not work so hard to please those special interests.
Mm-hmm.
And if instead, if the campaign contributions, the support for their election came from the general population, then the politicians would be more likely to support legislation which helped the general population instead of the rich people. So make that thought experiment. Think about it.
Mm-hmm.
And if you think it's a good idea to make it fair, to make everyone equal, to make the rich people and the poor people equally able to influence their elected representatives, then come with us. Join our organization, work with us, and let's try and do it. The American people are wonderful people, and if everyone works together, we can probably do it. So, think about it. We are a divided country. 34% of us are left, 27% of us are right, and the remainder, 39%, are in the middle. We ought to be able to work it out where we can compromise so that rich people can keep a fair part of their money and poor people don't have to eat dog food. And to do it, everyone should have a seat at the table. Think about it and contact us.
Thank you very much, Stuart. I do want to ask you one more question, though, on this. After all these failures to repeal the Affordable Care Act, Donald Trump has said that, well, let's just let it fail. Is there a danger of the whole thing collapsing, and why is that?
Well, if we didn't do anything, there's a huge danger of the whole thing collapsing, but I don't know that that's going to occur because these guys want to make money. most people act in their own self-interest. The politicians don't do anything but collect money and run for office. They know that if the healthcare system fails and everything, and we have hospitals closing and people unable to go to see their doctor and nobody able to get insurance, that they'll get booted out of office and someone else will do it.
Mhm.
So I have a lot of faith in our system, and I think our system works. It just needs to be fine-tuned.
So basically, if you run out of people to profit off of, then there's no system left, and then what do you do?
So I think the country won't let it fail. But if you did nothing, if we let the system fail, you'd go to where you are in Somalia, where people live to the age of 40.
Well, I think that, how far does it have to go before we realize that it's gone too far and we have to reverse course? Is
I
that...
think it was yesterday. I think when everyone realized that they couldn't stiff the whole populace. They couldn't get a law passed that only 12% of the people approved of. It should be abundantly obvious that we need a new way of making decisions.
Well, thank you very much, Stuart Phillips, our executive producer. And if you would, in fact, like to join us at Make It Fair, you can go to our website, makeitfair.xyz. You can find us also on Facebook and Twitter. My name is Harmon Dash. Thank you for joining us.